And my topic today is actually the no drill techniques. So what minimally invasive dentistry should be. Now, what I'm going to be talking about today is something that I've been practicing for many years, and I continue to do in my office because my first option is always to preserve what my patient has. The less damage this system is gonna have throughout the years, because we all know that everything that we do is irreversible and eventually will fail. So let's keep that in mind, and that's kind of like the introduction to my presentation, because I want to take you in a completely different direction. I want to take you in this direction where we can make beautiful smiles without having to sacrifice such a beautiful and valuable tissue like enamel. So to start with that, I want to just kind of overview with you what is a minimal intervention concept today in dentistry. One of the things that is key in my office in order for me to perform any restorative procedure is rubber dam isolation. And rubber dam isolation is a skill that we have to develop. Now, not only develop the skills, but also understand that there will be some cases like the one that I'm presenting to you right now that are going to become slightly more complex, and that they're going to require specially designed or altered clamps in order for us to be able to accomplish or achieve complete control of the operative field, as you are seeing in these photos. Now, prior to the patient sitting in my chair, I scanned her, I did a digital wax up, I created a lingual matrix out of that digital wax up, and now I'm going to go ahead and restore this tooth. We're going to talk about enamel micro-abrasion, and we're going to talk about minimal intervention restorative procedures, all of which fall into this group where you're trying to make patients improve their smile doing the least amount of dentistry possible. So let's talk about the single dark tooth, because I know you see these cases all the time in your practice. Now, the first case that I'm going to share with you was a case that we published a couple of years back in Compendium. It's a very nice case because, as you can see, tooth number 9 has just a slight little darker its appearance compared to tooth number 8. And it's not that the patient wasn't even aware of it. The only reason why I was able to notice the difference was through the photo. The other issue that we have is pulp canal obliteration. Now, pulp canal obliteration is another reason why you can have, dark teeth. And I have seen it all over the internet. These patients are getting either composite veneers or porcelain veneers with some type of tooth reduction. And of course, if you think about it, even if the patient does need porcelain veneers, we all know that you can have much less tooth reduction if the color of the tooth, if you do not want to modify the color of the tooth with the porcelain veneer, than if you have a dark tooth and you want to or need to modify the color. If you need to modify the color, you need to have additional enamel reduction. So think about that. For any case, even if you need a composite or a porcelain veneer, you are going to benefit from bleaching first, because you're going to have a better substrate and you're not going to have anything to hide. Yeah, some of these cases take longer than others. Not every case is going to be a 15-day case. And I'm going to share with you this case, which took me a little bit longer than that. But I want to show you that if you as a dentist are patient and believe in the science and what you're doing, the outcome is there. It's just a matter of time. So there are the windows on 7 and 10. The tray is there. We give the patient 10% carbon peroxide, and you can see that little by little. I'm showing you there with dates, 5 days after using that 10% carbon peroxide, 13 days after using 10% carbon peroxide. You can see that little by little, the tooth starts getting lighter from the incisal third, and then it works its way up to the gingival third. And then you can see 21 days later, 10% carbon peroxide. This is now the patient was getting married, so we decided to go a notch higher. We gave her 20%, and we were telling her, be careful, we want you to remove any excess. We don't want this to be in contact with the tissue. We kept the same tray, so we didn't do any reservoirs. She was a dentist, so she understood that she needed to be careful. 1 week with 20%. Then we gave her, this is the 3-week post-op with 20%. You can see that the teeth are getting lighter and lighter. Tooth number 8 is still a little bit darker on that cervical third. Now we're giving her the regular tray, and we're going to start using 20% on 8 and 9, 10% on all other teeth. Let's talk about micro-abrasion, because micro-abrasion is another great tool that we have to try to improve smiles. And again, this is one of my patients many years back. I completed this case, and you can see where we're at. She did not want her teeth restored. She did not want her teeth restored. That's why she had tried bleaching, she had tried many things, but these white spots and brown spots are still there. And now she knows about microabrasion. Is there anything that we can do for her to improve her smile? Again, you go through the classification of the fluorosis index. The only thing I want to say about this chart, all the numbers that you need to know is, in my mind, 3 and 4. TSFI 3 is all on enamel. You see the white. Once the white starts becoming brown, you're at the level 4. So if we were to classify this patient, we're gonna say that she is a TSFI or fluorosis index of 4. If you want the highest, which is 6 or 7, this is what that looks like, because this is, now you have pitted enamel, so you can see the irregularities of the enamel. And this is all fluorosis. And this, I would always recommend being conservative, using microabrasion and bleaching, and then see if you still need, in some cases you will need to do some restorative dentistry. But again, let's go from less to more. That is always my advice. Now, does every patient out there with severe fluorosis only requires microabrasion and bleaching? And the answer to that question is no. And this is a case that I recently completed that I wanted to share with you, because this was a very, very difficult case. And it was difficult because of the patient's expectation. She wanted a beautiful smile. She did not want to have any of that white or brown left behind. So we knew that this was going to take a good time. And I'm going to show you, because this was a long treatment, but I'm also sharing with you the outcome. And this outcome did require some restorative work. But I want to share with you this case, not because I used the burr. No, I want to share this case because I want to show you how less of a reduction I had to do for this case, thanks to what I did previously for her to try to reduce the white spot with an ultra conservative approach.